Welcome, everyone. I see participants rolling in. We'll give it another minute or so. I think maybe I will get started just in honor of time. There never is enough of that. Good afternoon and welcome, everyone. My name is Sheila Schuline, and I'm a prevention consultant with Elder Abuse Prevention Ontario. And I also have the pleasure of being the moderator for this afternoon session. We encourage you to comment and network with each other through the chat box, but we ask you to put questions in the Q&A box instead, just so that's one spot for us to monitor and we'll be saving some time at the end to do those questions. So please enter them in the Q&A box. For this afternoon's session, Stopping Gender-Based Violence in Women 55 Plus Through Promising Practices, I'd like to first introduce Margaret MacPherson. Margaret is a research associate with the Centre for Research and Education on Violence Against Women and Children at Western University in London, Ontario. Margaret designs and develops curriculum and related materials on a number of initiatives, including the Make It Our Business, Workplace Domestic Violence Program, and It's Not Right, Neighbors, Friends, and Families for Older Adults. Margaret is passionate in her belief that everyone has an important contribution to make in creating safe and supportive environments at work and in our communities. And secondly, Bénédicte Schoepflin. Bénédicte has been the Executive Director of the Canadian Network for the Prevention of Elder Abuse since 2018. Prior to her work with CNPEA, Bénédicte managed a historic and slightly haunted house museum right next door to the West End Seniors Network in Vancouver. She then worked with the BC Law Institute and the Canadian Centre for Elder Law. Though nothing predestined her to work in elder abuse prevention, Bénédicte cares deeply about making our society more equitable, inclusive, and safe for all ages. Thank you, ladies. I'll turn it over to you.
Thank you very much, Sheila.
Thank you, Sheila. Hello, everyone. It's a pleasure to see you all, and I wanted to thank you for being present with us today. As the co-organizer of this event today, CNPEA was very, very involved in the building of the program and in what a program it's been so far. I attended most of the presentations today, and I'm in awe, and I feel really lucky that you chose to attend ours this afternoon. So as Sheila said, I'm Bénédicte Schoepflin. I'm the Executive Director of CNPEA, and I'm joining you today from the unceded and ancestral territory of the Coast Salish people, which includes the Musqueam, the Squamish, and the Tsleil-Waututh nations. Some of you will know this as Vancouver today. If you don't know about the CNPEA, I'll give you a very brief overview. We are the only pan-Canadian organization that is focused on elder abuse and neglect prevention. We build awareness, support, capacity for a coordinated pan-Canadian approach to the prevention of elder abuse and neglect. And the work we do is really to promote the rights of older adults, and that's through knowledge mobilization, collaboration with a bunch of organizations that are like-minded and focused on elder abuse, GBV, and many other sectors, policy reform, and education. And the goal is that if possible, all older adults in Canada can have the support they need to thrive within their communities and to be free from violence and neglect. And so the thing is, when you work in elder abuse prevention, it's really impossible to look at abuse against older people without noticing the strong gender component of the issue and without examining gender-based violence, family violence. In these sectors, historically, when we're talking gender-based violence, elder abuse, there's been a disconnect historically between these sectors, unfortunately. And that's kind of where the idea or the root of the project, the STOP-GBV 55 project, came from. Thanks to funding from Women and Gender Equality Canada, we've been able to involve a wide group of partners. You can see their names and logos on the screen right now. And we wanted to engage collectively in a reflection to develop enhanced practices and offer better support for older women and gender diverse people who are experiencing gender-based violence. So as you can see, it's a fantastic group of partners. It represents many sectors. We are talking shelters and interval transition housing, violence against women, New Canadians, community support services, etc., etc. And they represent the interests and the needs of women that are experiencing systemic barriers and oppression. And that's including Indigenous women, members of the 2S LGBTQI community, women who live in rural and remote areas, refugee and immigrant women, women living with disability, and Francophone women. So it's really trying to take a fully intersectional look at the issue and to put our minds together to develop a well-rounded set of new way of looking and approaching the issue of older women and gender-based violence. So the project is ongoing. It's going to keep going until 2026. But we do have a fair bit to say already about it and kind of the greater vision. And for that, I will let Margaret MacPherson take over. She is our project manager extraordinaire, and she's been bravely leading us on in reflection and soon to be action. And she can tell us all about that. Go ahead, Margaret.
Thank you very much, Bénédicte. And hello, everyone. It's so nice to, I can't see you, but I know you're there. I feel your presence. I appreciate it. So I am going to talk about the journey of this project and, sort of where we started. I came to the project, it was about a year in, and, we could see like the first year, there were lots of discussion. I was a project advisor initially, and there were lots of conversations about what can we do that is really useful. This is a time where we want to contribute something that's meaningful to the work. And this was just really our starting point. The one piece that that was completed is the scoping review. And I'm going to talk a little more about that as we go further on. And the starting point, I would say, has changed in some ways, not the intent or the, sort of the bottom line deliverables on the project, but the way that we're moving forward has shifted quite a bit. And it comes, I think, from really thinking about the way in which structural violence informs, it needs to inform everything that we're developing and talking about. Age discrimination is, in the bones of our society, and older women's, gender diverse people the lives are hidden and devalued, for older people in specific ways. So, for example, global studies were done on domestic violence, but they didn't include older women over 50, just over 49. That was the cutoff age for the surveys. The National Action Plan on Gender-Based Violence itself does not really mention older women as a group that faces unique barriers to getting service, to being seen as a group. And, so, I think these are the things that help us see how really age discrimination is one of the most still socially tolerated forms of discrimination that we're up against. So when we're talking about older women, if you start at 49, if you start at 55, we're talking about at least 2 entire generations that are overlooked by research funding and the provision of services. So that's kind of where we're starting from. We also know from past research, this was a study done by the National Initiative for the Care of the Elderly in 2015, that, there's a significant portion of the population that has experienced elder abuse in sort of its broadest forms. And we know those numbers are always really conservative because of underreporting for a variety of reasons. But if you focus on some of the risk factors, the things that make you more exposed to violence as an older adult, being female is right there. And then you're going to see that it's most often a spouse or a family member that is causing the harm. And so for me, that harkens back to, the work that I've been doing at the center around educating and engaging everyone on learning to recognize warning signs and risk factors. We started with neighbors, friends, and families as a public education campaign, and later developed It's Not Right, Neighbors, Friends, and Families for older adults as public education and engagement tools around understanding that it's almost always happening in people, that we know. It's about relationships. And so how do we prepare everyone to take action when they see things happening that make them feel uncomfortable or that may cause worry about a neighbor, friend, or family member? And so gender is absolutely a factor, and the number of older women who are killed by their partners and family members is the hardest kind of proof that we have to talk about this as gender-based violence. And there is a sense of urgency as the population ages. We are seeing increases in femicides, in older women seeking help. And so gender is one factor. And then we also have to consider, the fact that violence is not uniform in how it manifests, and that people's social location also contributes significantly to the way that they experience violence, and the systemic inequities, the structural violence that informs lives and behaviors. There's significant gaps in research, right? So first of all, we're talking about this idea about multi-generations, at least a couple of generations, with a 40-year age range. If you think of people living into, close to 100 from 60, those are significant changes in a life. You can't just lump all people together and call them seniors and think that we're going to be able to say anything, significant about it. There's also these competing paradigms, because elder abuse grew out of social gerontology and geriatrics. And then when you look at the violence against women sector, sort of the grassroots feminist mobilization around violence against women, these are three different ways of thinking about violence and abuse that sometimes compete with each other in terms of having different ideas about why things happen and how things happen. And this creates a field where there isn't a lot of consistent or coherent research. And as you probably know, older women are under-researched generally for some of the reasons that I said a couple of minutes ago. This is really important because funding follows research. And so if you have global studies that say that imply that older women don't experience domestic violence in particular, by not asking them if they do, then it's not surprising that there isn't a lot of attention paid in funding to look after, to speak to the needs of older women. And this shows up in our service system. So in the direct services, there are very few, or I would say no, dedicated elder abuse services specifically around gender-based violence for older women. The violence against women sector has made a lot of strides, I think, in the last few years in terms of understanding that there was a gap, there was age discrimination that was happening in the way that the system was responding to older women experiencing violence. Older women and gender diverse people, I would say, they've gained a lot of ground. That's the one I know the most about. I think there is also movement in healthcare for sure to increase understanding about gender-based violence and the response. But I would say our institutions are really still stuck in a way of responding that is not sort of moving in the directions that we want them to. And I'll talk more about that. The entire violence response ecosystem is crisis oriented, which I would say, short of doing nothing at all, is the most expensive use of taxpayer dollars. Is not very good. If you're waiting for the violence before we have any kind of a systemic response, then we're waiting too long. So moving upstream toward prevention has to become the focus. Elder abuse is often included under family violence, but I hear from people that it's ignored to some degree. It's there, but it's not really a focus. The focus is on younger people. And there's little recognition of elder abuse in the community. 91% of people are living in their homes. They're not in institutions. That's part of the stereotyping that we have to address. And there's also little recognition of the need for specialization and training for professionals, right? I think if you're working with older people, generally speaking, you really have to be trained to recognize warning signs, indications of escalating risk, and where to find specialized services in your community that can bring that gender-based violence expertise to a situation. And there's little or no risk management happening anywhere in terms of working with the people who are causing the harm. And then, of course, there's things like, this propensity to call it mercy killing when you have a couple, an older couple, where the partner kills the other. It's usually a male partner who kills his female partner because she's sick or because she's ailing, and it's attributed to mercy killing, which is such a wrong definition, because the research is really clear that the women are not asking to die. They don't participate in the decision, and the murders are anything but merciful. So thinking about the way we talk about these things, there's been several people talk about that today. I've appreciated the other presentations very much as well. How we think about these things, rationalizing the murder of an older woman because she is in need of care is really problematic. So we do have inquests into these kinds of femicides where you have just femicides. We do some inquests into them. And this slide I'm showing you refers to an inquest that was done a year ago, in June 2022. In Ontario, there was a provincial inquest into the murders of 3 women who were killed in Renfrew County by a man they'd had a relationship with in 2015. And there were 86 recommendations that were produced out of the inquest. And the first recommendation was to declare intimate partner violence an epidemic. And since that time, over the past year, starting in Lanark County, we've seen, as of today, there are 76, I had 3 this morning declare intimate partner violence an epidemic at their local government level. And so I think this is such an important shift, where we're starting to see local governments understanding that they have a role to play, which I think still needs to be articulated, because declaring an epidemic and actually moving to address it are 2 different things, but it's a good start. I'm showing you this slide because there was also an inquest just a couple of months ago into the murder of Gladys Ryan, who was killed also in Ontario by her husband at the emergency department of a hospital, where they were put together in a room despite lots of warning signs and indications of risk. No one knew he smuggled a gun into the emergency room, but he killed his wife, and then he pointed the gun at the police and he was killed. So there was an inquest into her death as well, and recommendations that were produced. So the juries produced these recommendations. They're not mandatory, though. That's part of the problem, is figuring out how to actually act on recommendations. So there's recommendations about what we should do, and then recommendations also to usually particular governments, departments, organizations, institutions. I showed you the Building a Bigger Wave slide and the map because I see, just because I'm aware of both inquests, that the Renfrew inquest generated a lot of attention and interest. And the Ryan inquest in particular, I've not seen a lot of media attention about it. And so I think it's incumbent upon us to make sure that those recommendations and that inquest also are factored into our thinking about how to move forward. All of these things speak to, the invisibility of older women and their circumstances, and how, systems conspire to keep them in the shadows. Out of recommendations, I think often we want something that works. We want a tool to fix things. And this project was no different in terms of wanting to do something that's useful, wanting to create something that can make a difference. But what we saw pretty quickly was that, the tools are tools. It's not so much the thing itself that matters, it's how we use it that makes a difference. And so that's where we started really leaning into what can we do that would be useful for people. Because, the reality of what we're looking at right now is that as you get older, the horizon sort of diminishes. There are fewer choices that are available. I'm in my 60s. I see it coming. And I think that there are things that we can all do because we're all getting older. Like, this is not something anybody's going to get away from. And if we are not actively thinking about how to support older women, older people, generally speaking, in being part of the solution with us, then we contribute to, sort of the sad view of the future. Because it's a big rock we're trying to push up the hill, trying to get to prevention, moving the whole system upstream toward prevention. That's the big thing that we want. And the older you get, the harder it is, I think, to make the climb. But it doesn't negate the importance of trying, of thinking about things that we can do on a daily basis that do make a difference. So these are the kinds of dilemmas that I've wanted to put out to you and to say, this is, the kind of ruminating we've been doing around what will we do that's actually useful. And I think there's another sense of urgency around our current state, that the entire violence response ecosystem is underwater. It is not adequately resourced. People are drowning in the work, leaving the work in unprecedented numbers because it feels so important. So I've never really worked on a project before where I just felt like, oh, we just really need to do something that is useful. So that's what we're working on. This is from the scoping review that was done. And so the themes that emerged from that scoping review, confirmed things that we already knew, but it also pointed the way to the work that we wanted to do right here in thinking about the focus on social support and empowerment and how to actually do that. I think this aligns so well with the call for a new framework by the Missing and Murdered Indigenous Women and Girls National Inquiry. And I put these words on the screen because I just think they're so powerful, and that we underestimate what it means as a society if we were to actually privilege relationships in the way that that's being called for as a new framework. And it's at the point of the encounter, one person and another, that change can really happen. Relationships are key to both understanding the causes of violence and to making the changes that end violence. Because it's true, we are individuals, but we're also defined by our relationship to others, that space between us. This is what makes us who we are in so many ways. So I think that the work that we're doing also has to support this call for a new framework in an action-oriented way. We just don't want to be talking about these things. We want to be doing things. So this is from research that was done by Nadine Wathen. She's been one of the leading researchers on the trauma and violence-informed research and development of resources. So these are two pieces that she wrote, and I'm just going to highlight a couple of them. This is coming off of the idea about a tool, a thing that can help fix things. The idea of screening tools themselves, her research says, no, universal screening, routine screening, this is not really a good idea. It actually is part of the problem because it kind of routinizes the relationship. It doesn't privilege it. So, and they can demonstrate with evidence that it doesn't lead to increased referral to resources or benefits to those who disclose. So it's not trauma and violence informed in the way that most people want to work. And so what's recommended is more of what they describe as a case finding approach, which means you have to explore the situation with the person, and you ground that in a knowledge of clinical indicators and risk factors. How do you know a situation is increasing in risk? You have to have a conversation about it. And then they've also tied to the World Health Organization's protocol, listen, inquire, validate, ensure safety and support. So these are evidence-based practices and policies that I think can help us move toward recognition of intimate partner violence and referral in a more systematic, humane way. It really comes down to this idea that, the tool that we want, the thing that we want is the idea of a simple solution. If you think about simple as being in the sense that if you have a recipe and you follow it, you will get the cake that you want. Complicated is just a little more of the same. It's building a rocket ship takes a little more expertise, but it's still a matter of following the directions. The space that we're working in is complex space. It's raising a child. There is no manual that is going to help you do that in a way that you can just check boxes and say, we did that to get to the outcome. Everything we're talking about is about becoming comfortable and confident about working with complex situations, which are people's lives, and how we interact in that. I think it's really important just to remind ourselves that about this idea, right? That culture is to humans as water is to fish. It's hard to see the things that's just part of our everyday normal. And it's hard to see the places in which we can actually lean in and make a difference by being aware of what's around us. And I say this because people often say, we already do that. We already do these things. But I would submit that if we were already doing them in a way that was collective, we would see significant changes. I'm not a person who doesn't think I do think things are changing. I see lots of changing, but I do see a sense of urgency around needing to make a difference in a meaningful way for a lot of different reasons, as the pressure to provide services increasing. This is also part of the structural violence as more and more people struggle to survive because of gross inequities in the social system, in the economic system of the world, where the wealth goes up and poverty comes down to crush more and more people, violence rates go up. It's just a fact. And so we have to be, I think, advocating for the larger forces, the governments. I think Myrna's talk this morning is exactly right. We do have to be working at a system level and calling for significant change, calling government to the table as partners to work with us to help us improve the system and people's lives and our own lives in doing the work. So the challenge is, if you're saying, well, we already do that, somebody else said it, I think in the last panel I was listening to, we're always learning, right? Like there's not a graduation date here. And I think we have to become really adept critical thinkers in reflecting on the way in which we encounter people and ask ourselves, in each encounter, how did that go? What was my impact? What could I do differently next time? In the Missing and Murdered Indigenous Women and Girls call for a new framework, the encounter is at the center of it. That's the powerful piece. Because you are the intervention point in a complex system. And I think that often we feel like we are victims of circumstances so far beyond our control that we have nothing to do but be swept along by it, that there's really nothing we can do to make a difference. And that is not true. Because in an interconnected, interdependent system, which is what we really are, dependent on each other, interconnected, one small action can make a huge difference in a person's life. And I think that if we took that seriously, if we took it at the level of the encounter, one person and another, and we brought ourselves into that relationship according to the principles I'm going to talk about in a minute, that we can make a huge difference. This is not just working at the individual level. This is working in a systemic way and understanding that you are part of something so much bigger than yourself. And you want to be doing everything you can to influence change in the system, in the direction that we need to go. And to find that, you just have to think about why you do this work and why it's important to you, and why you want to make a difference. Because ultimately, I think almost all people who get into care work want to make a positive difference in the world. But we have to be willing to struggle together to figure out how to do that. And if we do that at an individual level, it can aggregate to system level change. This is why movements are so important. That little picture I showed you of the map, all those communities that have, gone out and declared intimate partner violence to be an epidemic just in the last year. That's the beginning of a movement of change, of engaging everyone in the issues, helping people see that what they have to contribute is important, it's meaningful, and can be done from anywhere in the system. So we started this project with the idea of an assessment template for screening, assessment, and interventions. And I've just explained why we've moved away from this in favor of the idea of reshaping the system in some way. So now we're talking about a tool, yes, but it's more about reflection for people to think about what's the encounter like? What's the quality of the encounter like for me? With this person that's in front of me that we've just had this exchange. And these work off the trauma and violence informed principles that I think are really could be a bridge across all kinds of sectors and disciplines and mandates, because they're simple in some ways. And they build off of all the trauma-informed work that's been done that came out of the States. So it is a Canadian innovation, becoming trauma and violence-informed, and all the research that's gone into that. The Public Health Agency of Canada has made huge investments in it. If you Google that, you go to their website, they have a great website around being trauma and violence-informed. It is fundamentally designed to increase equity at the individual, organizational, across sectors and community levels, ultimately at a societal level. So these are the principles, these are the sort of the operating pieces that we're working with. And I just come back to, that idea again that shifts within multiple elements across many systems. If we all do 1, 2, 3 things, we can actually drive larger changes that aggregate at a population level. But it comes back to stepping away from that idea of I already do that, to instead thinking, yes, I do. I'm already working on that. I'm already care about this. What more can I do? How can I do this in a way that increases my efficacy, my autonomy to work in a system that is largely dehumanizing? So these are the 4 principles. The first one is about understanding structural violence. This is the V in the trauma and violence informed. It's not just trauma informed at an individual level, it's trauma and violence informed, so that we understand the systemic factors that impact on people's lives and their behaviors. The second one is about creating safe environments. So cultural safety is a way of practicing and providing services that respects and values the identity, experience, and needs of people from different cultures. Doesn't matter what their social location is. It is a fundamental human right and a legislative requirement for public agencies, but it does involve a shift of power from the provider or educator, the knower, the expert, to the receiver of service, right? Who defines what's right, what's to be done, to a much more mutual kind of relationship where, there's a lot more curiosity and understanding that how power works. We have to talk a lot more about power, but I don't have time to do that today. The third principle is about fostering real opportunities for choice, collaboration, and connection. And I submit that it is a radical act to take time with people and to give them time to think and to listen to what they're saying. My father is 91 years old. I have to slow down. I have to slow down in order to connect with him. And every time I do that, I am enriched. I feel like he enriches my life because it asks for that from me. And that is a narrative of rebellion. Instead of becoming working machines in a system that incessantly wants more from you, you can hold on to your autonomy by taking time with people and privileging the relationship and the voices of those who are seeking support. You know, they're the experts of their lives. And that's the fourth principle, is about cultural humility, is how I think about this. We have to, it's a process of self-reflection to understand the kind of biases, the water that we're swimming in, that we can't see unless we are, I think, in relationship with others. We need other people to help us see the ways in which we're complicit in maintaining the status quo. We don't do it because we're bad people. We don't do it because we don't care. We've just been indoctrinated into a bad system. And so we're going to have to be really strategic about how we extricate ourselves. We have to help each other do this. So we need a lot of compassion, I think, for all of us who do this work, and for everyone who wants to make a difference. We're all learners in that sense. This is from the Equip Healthcare website. This is where a lot of the resources live from that Trauma and Violence Informed. It's honestly, it's a great website. Go look at it. I think Bénédicte's going to put a link in the chat to a video. I'm not going to show you. It's too long to show you, but it talks about trauma and violence informed principles in a way that I think you will find helpful. And then I want to come back to Future Us. This is the roadmap to elder abuse prevention that was developed and published a year ago by the Canadian Network for the Prevention of Elder Abuse. I was involved in that project, and we did a lot of collaboration, a lot of talking and thinking about what are we going to do to move upstream toward prevention? How do we engage everyone in it? And so there are three goals to this plan. You know, we want to prioritize prevention in every community. We need to establish and support elder abuse prevention networks. And for me, there's a link between the Violence Against Women coordinating committees too. This is the collective work in communities that we so badly need to do. And so this is, I think, part of what we are advocating for with governments, is that they need to help us put this infrastructure into place in a sustainable way. The work of community coordination, the work of public education requires sustained funding. It is, we talk a lot about fragmented systems, siloed organizations. If we're going to actually figure out how to work collectively, I really think that networks, coordination committees can help us do that. And then the last one is about teaching everyone to be able to recognize warning signs of abuse and neglect, how to respond safely and effectively, and where to find help in the community, where to refer, recognize, respond, refer. These are the three goals that we're working on with Future Us. And in that work, we've already identified how organizations can become trauma and violence informed. There's so many resources that can help you do this, not in a way, as someone was saying, where it's a policy, it's a bunch of words, but in practice. And we really need to do this to not just to enhance, increase the equity in our services, but also to support the people who are doing the work. And we really do need to focus on age discrimination, and I would say ableism as well. Like, these things go together so closely, and they're so much on the periphery. This is Implementing Trauma and Violence Informed Care. It's a handbook for practitioners. And I think it has lots of great stories in it about how do we put this into the water system, this kind of practice, right? So that it doesn't matter what tool you're using, it's how you use the tools that are available that make the most difference. So yes, tools are important, but it's much more about who you are as a person using the tool than it is about the tool itself. And I think for me, that's the fundamental piece is, how do we change ourselves to become part of the solution? How do we envision ourselves as world builders, as creating something together that no one of us would ever be able to create alone? So we're going to be doing interviews with women, older women, and service providers, asking them to tell us about their exceptional experiences in service. What are the moments that really made a difference for you? Let's capture some of the stories about what actually works, and then let's talk about how to do more of that. And so this will, we're just waiting for ethics approval on this, and then we will be seeking interviews. If you are a woman over 55, a gender diverse person who wants to participate in the interviews, just reach out to us. We would be very happy to include you. And we'll be looking to service providers as well, wanting to talk with them about what are the exceptional experiences that stand out, where you felt like you were really able to do what it is that makes you feel like you're contributing. This is Equip Healthcare, the website. Honestly, there's so many resources there. These are just a few of them, but what they haven't really done is they haven't really focused on age discrimination and gender-based violence in older women in particular. So I think we have something to contribute to this body of work in a meaningful way. The idea of a self-reflection tool, just asking about what do I know? It's for you, right? How can I think about my encounters, the quality of my encounters, using those 4 principles? And then we're really looking at the existing resources about what's missing for older women, what else might we be able to contribute, where are the best practice examples that we are hearing about that are trauma and violence informed, and we'll develop some new content in terms of curriculum and this idea of a reflection tool. These are my last couple of slides. I just want to say that I think becoming trauma and violence informed is a survival strategy for those of you who are feeling absolutely fried by the overwhelming crush of demand for services and the inadequacy in the funding, which is all part of systemic sexism, misogyny, that doesn't care about women's lives in so many ways. But there are so many of us that I think that if we can figure out how to work collectively, and we look toward collectivist communities, leaders to help us figure out how to do this, Indigenous and other collectivist cultures, they already know a lot of this about how to work and think together, that we are coming too late. And then, it is about engagement and talking about what's happening and supporting each other along the way. How can we engage everyone in this work of moving upstream toward prevention? So, the questions, the ideas, we want to hear from you, because the future us is really up to us, to all of us together.
Thank you, Margaret. We are running out of time, as we always do when topics are bigger than than time allows. I do have some questions. I do have a question that, if we have a moment, it's a 2-parter, but I think it's worth an ask. How can we as individuals make a difference in changing the culture of gender-based violence and ageism? Are there simple things we can do to make a difference?
Yeah. I think it's in the encounter. It lies in thinking about yourself as a powerful person in the world. And how are your encounters going? Are you bringing to them the things that matter to you, the things you want to create in the world? I think that's the most everyday kind of thing we can do as professionals, but also just as citizens.
Back to you, Power. What are the two things that we can do to make a difference in the systems enabling violence? Would you have?
Bénédicte, do you want to?
Well, I was going to go back to the idea of the individual beyond, as professionals within a particular system. I was going to say every person can do something. And that's something that Marissa has touched on earlier during the panel as well. You know, there's every gesture you take to try to counter the narrative of ageism, counter the narrative of misogyny, every conversation you initiate, every time you stand up for something and say, no, actually, that's not okay to say this, or, well, that's blatantly sexist, which is something I would say because I lack the, the tact necessary sometimes. Those things matter. They help kind of put that wedge, that foot in the door to start talking about those issues more seriously. And when it comes to elder abuse, I would say, you know, it is part of the goals of Future Us when we talk about teaching everyone, being able to learn, educate yourself, you know, find some resources so that you can understand the issue a bit better, and you can be ready if somebody comes up to you and chooses to disclose something, you know, not so you're not bereft. If you find yourself in a situation where someone turns to you for help, or if you spot something that you think is a little odd and possibly worrisome, I think that is the first big thing you can do. And it seems like a small step, but I think it can have a massive impact.
Thank you both. And the presentation was filled with lots of wonderful information. I know myself, I'm going to go back and review it. It will be recorded. So stay tuned for a week. If you want to hear this again or go dive deeper and get notes that you weren't able to take today, you'll have that opportunity. Just go to our website. I'm going to invite you, I thank you both again for participating, and I'm going to invite everyone to go back to the main room for our wrap-up session, and we'll see you there. Thanks again.
Thank you, everyone.
Thanks. Thanks, Peggy.